Hey y'all, it's Dr. Tiffany. I hope you're doing well. Today we're going to look at some science. It actually potentially explains a lot of strange things that coronavirus does. It was an article that was published in Cell, which is a prominent scientific journal, and it contains some very remarkable findings. It came out a few days ago. First things first is one thing it found is that COVID is really good at infecting nerve cells that produce dopamine. Why is this important? Because dopamine is the primary type of cell that affects feelings of pleasure, motivation, memory, sleep, and movement. Once the cells get infected, they lose their ability to grow and divide, and instead they release markers that cause inflammation around it, which results in damage not to just them but surrounding cells as well. One thing that this may cause is it's thought to be putting people at higher risk for Parkinson's disease later in life, so that's a negative effect. It also, in people with acute COVID, it's also possibly the explanation for that horrible headache that you get, the loss of smell, and the weird taste that sometimes people get during the acute phase of COVID. In long COVID, it may also explain brain fog, depression, anxiety, and sleep issues. So long COVID sufferers, this is some very pertinent news as to why it's happening. And they actually did look at potential things that might be able to treat that. Now, these are not approved treatments at this time. This study is one that hopefully leads to further study of those treatments to see if they prevent these things in actual reality. But Metformin, a popular diabetes drug, a drug that treats ALS, Lou Gehrig's disease called Riluzole, and a cancer drug called imatinib, appear to inhibit the infection of the cells that produce dopamine, which would potentially prevent these effects from happening. So this is the article behind me. I encourage y'all to read it. This video is, of course, for educational purposes only, but it is a very interesting study that I think answers a few long-standing questions that I've had about this, probably that y'all had about this, and potentially leads to avenues of further study which could lead to treatment for long COVID, which would be a very good thing to have. And it may be treatment that needs to be initiated at the start when the infection is diagnosed. So this is very pertinent to medical professionals as well. That's science for today. I love you. Stay safe.